Hey guys, so here I want to talk to you all about swelling, and most especially the swelling that occurs when our bodies are attempting to heal from any sort of injury that we may have experienced. Now, whether it's because we had a surgery, which is a planned injury, to say our knee or to our hand, or it's because we had an actual accidental traumatic injury, such as spraining an ankle badly or breaking a bone, swelling is going to occur especially during the initial stages of healing with that injury. And that swelling can be very uncomfortable and problematic and be very difficult to work with and to keep under control as your body is attempting to heal that injury. And what I'm going to map out in this video is how elevation is actually your best bet when it comes to managing swelling and allowing your body to heal as it's recovering from whatever physical injury you may have experienced. All right, so why am I recommending that any of us take on elevation as the primary approach to managing the swelling that will occur as your body is trying to heal any sort of injury that we have? Well, to best understand that, we can look at another situation where there's a problem with the body and some painful swelling occurs, and that's a sinus infection. Now, when you have a sinus infection, there's something going on, whether it's viral or bacterial, that the body is trying to fight and try to manage and sort of get under control, get rid of. And so you can have a lot of mucus buildup, and it becomes problematic if it's not able to stay flowing, and you can get painful sinus pressure building up. Well, when it comes to that kind of swelling that occurs with a sinus infection, you don't ice your face. It's not really recommended. And if any of you have tried that, you know how painful that would be. Instead, you got to keep it flowing, and you've got to use steam, you've got to use decongestants, you've got to use positions that allow the mucus that your body is producing to run through and allow the sinus infections to run its course, whether you need an antibiotic or not. So when it comes to the swelling that would occur at, say, a knee after a surgery or an injury, a sprained ankle, or a broken bone, what we need to allow for is the actual inflammatory process to just unfold. We don't want to use anti-inflammatories if we can avoid it. Instead, we want to allow the body to do its thing in order to pull and remove injured tissue and lay down new healthy tissue. And swelling is going to be a part of that. So we don't want to stop the swelling. We don't want to literally retard the inflammatory swelling process. That's what anti-inflammatories would do. Instead, we want to allow that swelling to wash out. And elevating an uncomfortable, injured body part is one of the easiest ways to do that. Now, in order for that elevation to actually be effective, it needs to be held above your heart. The part that is injured must be positioned above your heart. If it is below your heart, then you're not going to get an effective gutter effect at the tissues. The return to the central organs, your heart, it's not going to work out. So you need to be very particular about your positioning for that to work. Typically, this is pretty obvious. When it comes to an ankle or knee, you've got to lay down flat on your back and really aggressively get that ankle and that knee upright. And you got to prop it in a way that it can relax. When it comes to something like a hand, you've got to actually position that above your heart and then hold it in a way that you can relax it for a prolonged period of time. So at times, elevation can be inconvenient, but if you get aggressive enough of a grade, then the gutter effect is really, really dramatic, and you may find that you don't need to stay there as long as you would think than if it was really gentle, or if you didn't actually have the limb above the level of your heart. Now, there are times that other approaches can be really helpful when it comes to swelling. I do not recommend that you or anyone take on any sort of direct icing to a swollen part. The reason for that is that applying that level of cold to the surface of your body, to the skin, that's going to cause a lot of vasoconstriction. That's going to cause the blood vessels to constrict, and that is going to prevent the swelling to be washed out of the area. It's actually going to cause it to pool more. It may be pleasant when it goes numb and you feel a reduced level of discomfort, but the majority of that discomfort is because of the swelling pressing out into aggravated tissue. And if you simply manage the pressure from the swelling by elevation, then you find that you really don't need to do much else for comfort. That said, there are times that some cold water immersion can be really, really helpful. By definition, cold water is not frozen, so it doesn't get to that point where it tends to cause the whiteness, the blanching on the skin that we'll see when we apply ice to the skin for some short period of time. Instead, when you see people get into very cold water and then come on out, their skin is red. So it tends to cause vasodilation. And so that can be really, really helpful if you're able to get the injured limb safely into that water. In the case of like a surgery where there's a skin laceration, maybe some stitches, that's not advisable. But when it's something like a broken bone that's safely held together, there's no puncture wound, or something like a sprained ankle and there's some swelling, that can be really helpful. The other thing about cold water immersion is there tends to be a gradient, whereas if you get deep enough into the water, there's less pressure. Say if it just goes up to here, there's going to be less pressure from the water at your abdomen. And as it goes lower and lower, you get a higher and higher gradient of pressure. And that's really helpful for pushing the fluid back up towards the heart. So as long as you're safely able to get in and out of that cold water with whatever injury that you're managing, whatever reason why you have the swelling, that cold water immersion can be dramatically helpful. However, oftentimes it's a little tedious to do that, and so your best bet is to simply elevate the limb. Now, in combination with elevating the limb, there is a big aid in actually moving these structures around, but it must be pain-free and non-aggravating. Something like an ankle, you can simply pump the ankle comfortably in that elevated position. That's going to help wash the swelling out. Wiggling your toes is extremely helpful as well. Any level of non-aggravating motion, muscle activation tends to be very helpful, and you can let pain be an excellent guide as to whether it's aggravating or not. However, the primary approach that I'm recommending is still, above all else, elevation, and allow that swelling to work its way through, allow it to go into the area and then be washed out. I hope this video is helpful. Let me know if there's any sort of questions that come on up. Reach on out as I can be helpful. And regardless, I hope you're feeling good and you don't have much swelling to manage.